Okay, coming up, have you heard of the vampire facial? It's a facial that uses your own blood, hence the name. So we will show you how it's done and the results a little bit later on in the show.
All right, that was a lot of fun. Coming up next, you can say goodbye to dull skin because we are getting an up-close look at a new facial procedure called the vampire facial. You're going to really want to see this.
It's crazy, but it works, they say. We'll see.
It is 6:39 now. There is a new type of facial procedure that is growing in popularity. It's getting a lot of attention. It is called the vampire facial. Okay, because the main ingredient is actually your own blood.
Now, celebs like Kim Kardashian swear by it for smooth, glowing skin. And our favorite love doctor, Laura Berman, tried it out. Our cameras were there for an exclusive inside look, so let's check it out.
Well, the vampire facial actually is a procedure where we take the patient's platelet-rich plasma and paint it onto the face after making small holes or almost aerating the skin.
I made two main agreements with my husband when we got married. One is that I would never talk about our sex life in public, and two is that I would never get any plastic surgery. So the idea of this vampire facial, shortening the recovery time, but then still getting the benefits of a medical grade peel was very intriguing to me.
I clean the skin with a very gentle cleanser, and then I will apply a lidocaine cream.
Now it's tingling.
First thing I'll do is on your face, I'm going to gently just aerate it a bit more so the anesthetic really goes in.
No, I don't feel it.
Great. Going to draw your blood and then
I'm a baby about blood.
place it in. Be balanced. The top, and now we spin it for 5 minutes. Then we'll draw it, we'll paint it on, aerate it, and we'll be done. This is the platelet-rich plasma. This is the red and white blood cells. And then I draw it back, and it's just like any other liquid, and it's easily applied just with a finger, nothing fancy.
Kind of surreal that you're rubbing my blood on my face.
I'm just going to...
I think it just feels like scratches. Is that what? Now he's aerated me? I'm properly aerated?
Almost done. It's like
Speaking
liquid
of blood,
gold, no
blood,
joke.
sweat, and tears.
That's
you
right.
got the blood. But I didn't sweat or tear, which is good.
That's... Get this off. So you're red.
Yeah, I'm red.
And that's going to fade quickly.
Oh, look, yeah, you can see where the little band was. Okay, we'll see how it goes.
Oh, I'm sorry.
All right,
Just to
so-
do that. It's cool. So yeah,
We're all excited about it, like,
we're already analyzing her, but we got to look at the picture. So Dr. Laura Berman, Dr. Adam Cohen are here with us, and they're going to tell us more. So we're actually going to check out, I think, the before photo once more. So here we go.
You can't really see,
There's
can you?
Dr. Laura Berman before. And
Very cute hair.
Here she is now.
it's growing back very well.
Very brave to let the cameras go in and see all of that. Were you a little nervous about doing it? Or no? There she is now.
Yeah,
Okay,
here
let's
she
look up
is
close.
now.
You always look so good, but it does
You
look
know, here's
good.
the thing, is that this was my agreement with my husband when we got married. I was never going to talk about our personal sex life in public, which was, you know,
Difficult
hard.
for you.
It's difficult for me because I don't have many filters. And I wasn't going to do the Botox or anything that would change my face. Which is lovely. He's really adamant that he doesn't want me. He wants me just the way I am, which is very sweet. And it seemed very sweet at the time, but now that I'm, you know, moving into my mid to late 40s and I just went through breast cancer and had chemo, my estrogen levels are getting lower, the elasticity is changing, and I'm getting a little Botox envy. So this seemed like something
It's a perfect thing to do.
natural. Feels natural using my own blood.
Dr. Cohen, how quickly, I'm sorry, after a facial like this, would you usually see the results, and how long would this last?
Usually, depending on how deep or how much penetration we have, the redness can last anywhere from 3 to 4 days with a mild to moderate one, and you should see a lustrous sheen in about a week. And then as things settle in, you see a change probably in 2 weeks. And
And then how long does it last? Like, where's the optimal point to kind of keep it going? Like if you see good results and it looks like you're happy with it, you're glowing.
Am I glowing?
Yeah, so when does the doctor need to go back, or does it just depend on where your skin is?
He gave me a mild one, right? A moderate one?
I gave a mild, and that depends. People who have mild ones can come back up to every 2 months. If you give someone a very deep one, it's usually good for a year. People come in and they want it done. They want to get the healing over with. They don't want the repetitive downtime. If you have scarring and you need a really deep treatment, you can do more. It's really dependent, but most people who come in and get a deep peel, it's about a year.
And what's the optimal age, too, to start something like this?
I don't know if there's an optimal age. I think people in their 30s will start to do it to kind of stave off permanent changes, kind of revitalize the skin, get things going and turned over on a cellular level from sun damage or just from age-related slowdown of.
But it can be effective pretty much at any age.
It can, especially if you have scarring or something like that.
All right. Well, now
looks good.
there is another procedure that your husband would not approve of.
No, I wasn't allowed to do that one.
Because this one involves injections. It's called, it does use your own blood as well, so it's called the vampire facelift. It's a little more involved, and it's something that actually one of our co-workers, one of our staff members, Karen Wands, who is not smiling here.
She's usually a lot happier than
She
that.
really was excited to do it. So let's see her before photo. We just saw it, and then this is her, you know, having her consultation with Dr. Cohen. Now, how is the vampire facelift different from the facial that Dr. Berman had, Dr. Cohen?
If you think about it, the facial is more of a surface, whereas the facelift is more of a volume replacement. So by using a filler that you hear about, you inject that and then you follow that with the platelet-rich plasma, as we call it, that stimulates collagen formation and all the natural factors that will help restore some of the fullness to the face, because as you age, your fat actually deflates, and when you see wrinkles and falling, it's not because it just fell, it actually shrinks away and will help to restoring volume. So if you think of the facial, it's surface, whereas a facelift is more volume.
Now I see. So it actually helps the Restylane or whatever filler you use work better?
It also lasts on average 4 to 5 months longer.
Okay, that's what I was going to ask. How long? So, because you got facelift, you got facial. So Karen is here. I don't know about you, Jean. I noticed
saw the
immediate
difference. I did too.
I was like, Karen
especially
looks
right
good.
here.
She's glowing in the cheeks. Karen, how do you feel about what you did?
I think it did help tighten the skin, and people say I look a little younger, and that's
you know what?
I'm looking for.
And you don't have the, you know how we get those laugh lines here? Those aren't really that pronounced. They just look like your cheeks are lifted.
Yes.
My kids ask, what are those lines? I said, that's where the truck of life ran over Mommy's face. That's what happened. But Karen, we want to point out, you didn't do the eyes or the upper,
No, it
the
was
forehead.
just all in this area
She just
here.
wanted, do most people do?
Yeah, it depends on how aggressive people want to be. Also, when you look at her face, you have to look at it globally, because you really don't want to have someone look so rejuvenated here and then not here. So most people want to have a natural blended look. Less is more. In cosmetic surgery, people...
Because you want to be like that guy at the gym who works out like his arms but not his legs, and then he has those little...
That's a great analogy. It
Right.
truly
Is it?
is.
The little
And
chicken
most
legs.
people want to be freshened up and have things dialed back, but they don't want to look like they've been worked on.
Yeah,
this
we
is
agree.
We want to show a before and after again of Karen, just so you can look again.
Can you smile this
just
time,
because it'd
Karen?
be more fun to show Karen. There she is before, and then we're going to show them side by side. Karen, look straight ahead. And you can see, you could
You really
definitely
can
see
see
in
the
those
difference.
Make
cheeks.
the
Oh,
same
yeah.
face, Karen.
Wow.
Let's
Yeah.
see.
Her kids were on the other side of that
See
camera.
that.
All right, so overall, ladies, thumbs up?
Yeah, and it's, you know, it's non-invasive. It's very, even though you're taking your blood, it's sort of, it's nice that it feels like it's natural to your body, because
Right.
it is your own plasma.
Same for you, Karen?
Yeah, I think it's a great idea, and Dr. Cohen was very gentle, and it worked out really well. So it was
And
very
any man
subtle.
I want one.
with a needle and
Yeah.
blood and stuff, if you said he was gentle, we believe you. Thank you so much, Dr. Cohen. That
Thank
was
you for
really
having me.
Appreciate it. Thank you
Wow.
so much. Ladies, they look lovely. Come back in a few months. We'll do it all over again.
Check
What
it
do you
out.
say?
You're going to go with them
Right, I
next
was gonna
time. I
say.
can totally tell. If you want to to learn more about the vampire facelift or the facial, you can visit Dr. Cohen at his office, Art of Eyes in Glenview. All of the information is right there online, or you can give him a call and find out more. Cool stuff. A nice way to freshen yourself up for spring. Now, don't go anywhere. We've got a lot more coming up. And don't forget, it's Friday Jukebox.
Yes, you are listening to Stay by Rihanna, requested by Evie Leo. You and me will be right back. I forgot to ask if you have the desire to.